All right, welcome back to the Lightning Step Couch. My name is Benjamin Turner. I am your behavioral health advocate. We are coming to you from Denver, Colorado at the NAATP 2024 conference. Joining me today is Marti Paulson, the CEO of Project Turnabout in Granite Falls, Minnesota. Thank you so much for joining me.
Thank you for having me.
Can you tell me about Turnabout and what you guys are doing there in Minnesota?
Certainly. We've been in existence for 54 years, and presently we have 4 different locations. Our main campus is in Granite Falls, Minnesota. We have a women's campus in Wilmer, Minnesota, and another men's campus in Marshall, Minnesota, and an outpatient in Redwood Falls, Minnesota.
Awesome, awesome. What specific programs or services have been most successful for you guys?
Well, we have the full continuum of care from prevention all the way through to um, outpatient and continuing care. So we have prevention for 27 counties in Southwest Minnesota. And then we go on to have a DAP class, which is domestic abuse perpetrators class. And we have residential treatment. We have 80, well, let me think now, 101 beds in Minnesota in Granite Falls. And then we have a really significant women's campus in Wilmer. And that's our newest campus. We have 16 beds for medium and low intensity. But then we decided to build out our campus. We have 5 townhomes which house 11 women. And that is specifically for women in early recovery, advancing their education. So they can live there for free after treatment as long as they're in any kind of education process.
That's amazing.
So then in Wilmer, we also have 2 sober homes, one for men and one for women. And so it's really a full continuum, and it has all the dynamics of every level of care. We are ASAM, forward, so we have all of those levels of care. We are also, we have a 3.7, the highest acuity for withdrawal management. And we're really, really serious about looking to advance and expand our withdrawal management due to the fact that Minnesota is very low on detox or withdrawal management beds. And so we have been an advanced organization for many, many years and always looking to fulfill our mission, which is, serving as many people in our area and beyond our area that are asking for help. And our board of directors is dynamic and innovative and wants to see us to continue to meet that mission and not have to turn anybody away.
That's awesome.
And we've lived that mission for 54 years and continue to want to. We are nationally certified with CARF.
Okay.
And state certified with both Department of Health and Department of Human Resources.
It's amazing.
So we'd like to think that we're innovative, we're advanced, but yet really take that down-home mission to heart.
I love to hear that. That's great. Are there any challenges that you face with providing care?
Right now, as everybody else, we're challenged greatly with the need for professional staff.
Okay.
Being outstate Minnesota is really difficult. And so Project Turnabout actually formed our own program called Grow Your Own.
Yeah.
And we started to recruit 4-year graduates in the behavioral health fields. And then we pay for the tuition for them to get their licensed drug and alcohol counselor certificate. And then they in turn give us 2 years of their service. So it's really helped. We're just now starting to see the benefits to that program. And I'm afraid if we wouldn't have started that, it would be very difficult.
Oh, I bet. Yeah, that's an amazing program. I think that's wonderful that you do that, and it does help secure some staff for you, but it gives them an opportunity to learn and grow. I want to talk quickly about tech. What role does technology play in your facility, and how has it been leveraged to improve outcomes?
Oh, definitely. We use technology wherever we can. When COVID hit us, we advanced into using iPads, iPads for actually programming, but also iPads for family.
Yeah.
And so our all of our residents were able to visit with their kids every day, sometimes more than once a day, visit with their family on a weekly basis. We do family programming still through digital and telehealth kinds of situations. Our psychiatrist does all of her one-on-one visits with telehealth.
Okay.
And so we're able to have those those services for our people because of it. We have 2 telehealth outpatient programs, and so actually COVID did advance our abilities to meet the needs of people that are farther away than we'd like.
Yeah.
So that kind of has really made a difference, but also our involvement on the state level and the national level has been much more because of telehealth and Zoom and all those kinds of things. About 8 years ago, Project Turnabout was the driver of a Minnesota Rural Alliance for Treatment Programs. And so I'm the president of what we call NAATP.
Okay.
And we've been very proud of that. We now have 20 plus members, and it gives rural Minnesota a voice.
That's awesome.
And that has been truly successful and awesome.
What a great program. That's fun. Are there any any struggles that you have with technology inside your facility?
Well, we did until we got a wider bandwidth,
Okay.
because that was a struggle in rural Minnesota for quite a while.
Yeah.
And legislatively, they did some things that allowed us to get it. And so now it's much easier than it was before. But, just always advancing in technology, it's very costly. We were given a congressionally funded spending dollars for about $300,000, and we're able to put in security systems in all of our facilities, and that's made a real big difference.
I bet it has.
It
Yeah,
has.
that's great. That's great. So as far as technology goes, do you use software platforms to keep track of, marketing or clinical or billing? Okay.
We have an electronic medical record, and then with that, an electronic medication record, and that really makes a difference.
Yeah.
But we also integrated scanning.
Okay.
So we have barcoding,
Yep.
and when our patients come in, their pictures are, and then their name tags are made. They have a barcode that is specific to them, and so all their medications are barcoded. Their hourly checks are barcoded, that kind of thing as well. We run with a couple of different software packages for our CRM and our marketing
Yep.
kind of donor perfect
Yeah.
is what we use there. So trying to make sure that we're doing that across the board, but we're very data driven.
Yeah.
And so we have a whole data department, and they're driving more and more digital and technology type things.
One last question, and then I know you need to get to this event, so I'll end here. But with multiple technology platforms that you're talking about, and being data driven, is it easy to keep track of the data when you're going from software to software? Do you have any issues with that?
It can.
Yeah.
It can definitely. We sometimes have to take an Excel spreadsheet, download it into one, and things like that. And so that can be a trick.
Yeah.
The other thing is making sure that the medical record is congruent with the medication record, and that's not always something in behavioral health that's done. And so that can be a trick as well.
Yeah.
And if it could all be integrated, it'd be great. But there are some things you want to keep separate.
Absolutely. Well, Marti, I appreciate your time today. Marti Paulson, the CEO of Turnabout in Granite Falls?
Yep.
Granite Falls, Minnesota. Thank you so much for joining us
Thank
today.
you. Thanks for having me.
Absolutely.